Hello everyone and welcome to this webinar on health and nutrition. My name is Claire Howarth. I'm the Vice Principal and lead the pre-16 phase of the school. And health and nutrition are some key topics for us, helping our teenagers to develop their holistic journey through the school and beyond. And we want them to leave knowing how to look after themselves and those around them. And we thought this would be a great opportunity this evening to invite three of our staff to talk to you about health and nutrition from their expertise. So I'd like to invite Clara, May and Dean to switch their cameras on and say hello to you. So we have Clara Pang, who is our school health nurse. Clara joins us this year. She's covering for Saffron Brown, who's on maternity leave and is doing a fantastic job, and comes to us with a wealth of experience. And we thought it would be a great opportunity for her to talk to you this evening about nutrition in terms of how it can help look after our immune system. And then Dean Czirok Carman is new to West Island. He is a very experienced nutritionist and into fitness as well. And he's going to talk to you about the ways that we can entice your teenagers to eat healthily and hopefully with you along the way. And May Schroder, who works in our physical and health education team, is a very experienced PE teacher, but also an expert in health and fitness. And she's going to talk to us about how we can look after ourselves through exercise. So I'm going to hand over to Clara now, and she's going to remember to, I was going to say, don't forget to turn off your mute. And I'm going to hand over to Clara, and she's going to talk to you about the immune system. Clara, over to you.
Sure. Hello, everyone. Thanks, Clara, for introducing me. My name is Clara. I've been working as a respiratory specialty nurse for 12 years, and I've been focusing on functional health medicine for the last 5 years. Today, I'm going to share with you some simple health tips on daily living to help you to easily boost up your immune system. I hope it helps you and your family. Before we move on to the health tips, we're not on the right page of PowerPoints. Could we go back to slide one? Yes, okay. So yeah, this slide. Thank you. Before we move on to the health tips, it is important that we know a bit more about our immune system. By knowing how it works, we will know how to communicate with it in a more effective way. Every day we encounter a huge amount of microorganisms. However, the reason we don't get sick every day is due to our immune system. It's doing its job and we don't even notice. Your immune system has 3 levels of protection, as you've seen on the screen. Level 1 is the skin and mucous membrane. These are both natural physical barriers that separate the inner body from the outside world. For example, sneezing is a defense mechanism which works by expelling irritants out of the body. However, if the pathogens are able to bypass the barriers and enter our body, our innate immune system will take action. This is mainly the work of white blood cells and anti-inflammatory chemicals which detect and attack the intruders. This is our level 2 protection. Last but not the least is the adaptive immune system, which we can also call the acquired immune system. We have special T cells and B cells identify new pathogens or germs, memorize them, and then create specific antibodies to eliminate them. So in short, we stay healthy thanks to our immune system. So what simple things could we do to support it back? Next page, please. Enjoying nutritious warm fluids is very beneficial to your immunity. I would suggest vegetable broth and bone broth. I call this comforting soups because they are delicious and soothing. They are also loaded with many kinds of phytonutrients, antioxidants, and important minerals such as zinc and selenium. These protect our cells from oxidative stress so we can feel energetic all day long. I am really looking forward to Dean's part of today's presentation as he will show us how to make these wonderful soups. Next slide. There are many health benefits to drinking herbal tea, and it can be enjoyed during tea time or with meals. Turmeric would be a good choice. It contains a very good active ingredient called curcumin. This is a substance with powerful anti-inflammatory and antioxidant properties. So it can help all kinds of inflammation, including chronic joint problems, diabetes, and tiredness. Yes, tiredness is also a symptom of chronic inflammation. Another good pick is ginger tea. Ginger tea gives a warming and soothing feeling. It also helps to decrease inflammation. It's a great choice if you feel nauseous sometimes or even you have a sore throat. I recommend ginger tea especially for the ladies who often have cold extremities or frequent menstrual pain. One more yummy herbal tea I think you will enjoy is called echinacea. Echinacea is a kind of flowery plant loaded with several antioxidants. It has been used to prevent and treat cold symptoms upon first signs of illness. It can also ease the pain of a sore throat. Some studies suggest that echinacea can improve memory and learning. Next slide, please. Everyone knows we shouldn't be eating sugary food, but why not? As much as we love brownies, cupcakes, bubble tea, and concentrated juice, unfortunately, they are loaded with added sugar, which significantly increases inflammation, which put a lot of burden on our immune system. Food and beverages high in sugar also disrupt our blood sugar level, giving us an instant high, but which is quickly followed by a low after the sugar wears off. And the more sugar we consume, the more we crave it. If you really like sweets, you can choose natural honey or choose some low GI treats. Next slide, please. Okay, allergies. Allergies seem to be a very popular condition among children. Have you ever wondered what you can do if either you or one of your children suffer from a sinus infection or allergy? Here are some easy and really effective tips for you. To minimize allergic reactions and nasal congestion, you can perform a sinus rinse with a neutral saline when necessary. You can get saline in all pharmacies. This practice rinses away germs and irritants and keep the mucous membrane hydrated. Less nasal congestion will mean that you get a better night's sleep, and quality sleep gives you a better chance of recovery. There are mainly two types of rinse available on the market, the bottle one and the spray one. Any brand will do, it's up to you. Here are some demonstration video links on the slide, so you can explore if you're interested to know more. Next slide, please. The power of sleep. Sleep and immunity are closely related, and both help you to fight against infection. While you're sleeping, your body is producing extra potent molecules that can strengthen your ability to fight infections. It has been suggested that sleep can also improve memory. Have you ever noticed that when you're really tired, it's harder to remember things? Basically, this is your brain telling you that it's not getting enough sleep. When you sleep well, your body may be resting, but your brain is start organizing and storing memories. So getting more quality sleep will help you remember and process things better. In other words, you get more smarter. Sleep can also help to reduce stress. If your body doesn't get enough sleep, it can react by producing an elevated level of stress hormones. This is common as a result of today's fast-paced lifestyle, but deep and regular sleep can help prevent this. You may ask, how much sleep do I need? I would suggest for most adults, we need 7 to 8 hours of quality sleep per night. While for the teens, I would suggest to have between 8 to 10 hours. Next slide, please. So when we are designing our meals, a balance is very important. Don't forget to include colorful vegetables and fruits. The more colorful they are, the more vitamins and antioxidants they contain. Fruits and vegetables also provide us with the dietary fiber we need to get our gut moving. Next slide, please. Despite doing all the above, you can also consider nutritional supplements. Here are some recommendations for you. In terms of nutrients that are beneficial to immunity, I would suggest you to take multiple vitamins and minerals, as this is an all-round boost up. This usually consists of zinc, selenium, vitamin B complex, C and D, and they all work very well to help reduce inflammation and speed recovery. Fish oil is also what we call a powerful multi-purpose food. The omega-3s inside can reduce chronic inflammation, and the DHA and EPA are considered to enhance our memory and improve the mood swings. The fatty acid inside also can help reduce fat storage in liver, and for teenage girls can help soothe the menstrual discomfort. Does it sound exciting? And last but not the least is the probiotic. Probiotics are found in some fermented foods and are really important for gut health and immunity. They maintain a balance between good germs and bad germs inside our digestive system. This allows us to absorb and detox well, making us less likely to get sick. And it's amazing to know that probiotics can make us happy. Probiotics maintain a healthy gut, and a healthy gut produces enough serotonin. This is known as a happy hormone. Studies have found that 90% of serotonin is produced in the gut, but not in the brain. Consuming probiotics can help us to maintain stable mood and improve concentration and motivation. There are just too many benefits to name. And thank you very much. And that's all from me. Dean will now share with you some ways to boost your immunity through food and nutrition, as well as some tips on how to engage young people in the process. It's your turn, Dean.
Okay, thank you for that, Clara. Lovely introduction. So my name is Dean Czirok Carman. As Claire said, I'm new to West Island this year and have taken on the role of Teacher of Food Technology. So over the next couple of slides, I will present sort of some ideal recipes that are both suitable for parents and teenagers to help them boost their immune system and generally have a healthier, balanced diet, building on some of the points that Clara has made previously. Now, rather than present to you just recipe lists, at the end of the presentation, when these slides are shared, there will also be links to the recipes mentioned in this presentation so that you can view them in your own time. So 3 categories of food today, starting with soups and broths. Thanks, May. So just 2 recipes at the top there, red lentil and chicken broth and classic tomato soup, 2 of my favorites. Those recipes will be shared with you at the end. Now, one of the reasons I've started with soups and broths is they are an absolutely amazing and adaptable food. Okay, they are enjoyed across cultures, they're cheap, and they're easy to make. All right, so engaging teenagers in healthy eating, especially, one of the key barriers that I find is that they either lack the skill or the motivation to spend hours cooking sort of fancy meals. So soups and broths cut right through that. They require almost no skill, and they're pretty quick to make. So most soups and broths are made from a variety of different stocks, whether it's beef stock to vegetable stock. So you get a jam-packed recipe full of nutrients and essential vitamins and minerals, which will help boost your immune system. Collagen, marrow, amino acids, and other essential minerals, especially in sort of chicken broths, pork broths, beef broths, sorry. Sort of all those essential vitamins and minerals will support your joint health. They will boost your immune system. They will help with things like healthy skin, healthy nails. So it's not just the immune system. But one of the key things with soups and broths is the liquid element to them. They keep you hydrated. Now, I struggle to keep on top of my hydration on a day-to-day basis, but I remember being a teenager, unless I was carrying a water bottle around with me, more often than not, I'd find myself dehydrated, especially in the middle of a jam-packed day at school. So having a soup or a broth at lunchtime gives you that extra bit of nutrition, but it also will go towards keeping them hydrated. As well as this, touching on what Clara said about fiber, it's really easy to get a mix of sort of different vegetables all into one soup in one go, and that's your fiber for the day, and it really goes to promoting sort of a healthy gut and a healthy digestive system. Moving on for me, please, May. So the next sort of area of food that I wanted to cover was super salad. So I've got 2 salad recipes at the top, which will be shared at the end. Now, moving on from soups, it's not always ideal to carry soup around at school, okay? And especially you tend to want to eat your soup nice and warm in the evenings, especially as we move towards winter. But during the daytime, when you're on the go, salads are ideal. They're easy to store, right? You don't need to heat them up. They can be made from lots of leftover ingredients. And again, they're quick and they're easy to make. So really, really ideal for engaging teenagers in eating. Now, the thing with salads is they're quite colorful, they're quite appealing. You can add pasta to them, you can add a range of meats, and you can even go down and have sort of a mixture of fruits and vegetables in your salad, so you can get that sweet kick to them as well. These tend to be really easy to get jam-packed full of antioxidants. Now, antioxidants come from sort of your colorful fruits and vegetables, so your strawberries, your tomatoes, your beetroots, okay, and they're really, really key to getting rid of free radicals in the body, which generally just have a variety of unwanted negative effects on normal bodily functions. So packing your food full of these is a great way to get those antioxidants in. As well as that, these can both be vegan and vegetarian, or you can add a meat element into them or a dairy element into them. Sliced egg, scrambled egg, you can do a variety of things. So these go down really, really well, I find, with both adults and teenagers. The key thing with this can be a main meal or a side dish as well. So if you've got something bigger or you feel that a salad isn't enough, it goes really well with a variety of other foods, but you can also make it big enough to be the main focus of the meal. Now, key as well, touching on what Clara said, really easy to get lots of leafy greens in, which are jam-packed full of iron. So that will help with some of the negative aspects of menstruation in young girls and sort of growing up in general. So really good for that. Next slide for me, please, May. All right, now this is the key one, especially for teenagers, but for adults as well. Sugar and snack alternatives. Teenagers out there growing, especially those that are interested in lots of different sport or take part in lots of different physical activity, they are going to need more than their sort of 3 square meals a day. They're going to need snacks in between those meals. Otherwise, they're not going to make it through the day, and they're not going to stay engaged in their studies for 5 lessons a day. So snacks are essential, okay? Going hours and hours as a growing teenager is not ideal for your concentration, for your immune system, and for your general health. So adding in snacks, but reducing sugar is sort of one of the hardest things to do, especially as I remember being a teenager and I would always go for the sugary sweets or the salty bag of crisps or the full fat can of Coke. So 2 easy recipes, which will be shared with you at the end, are tea jellies and protein or bliss balls, as they're commonly known. So assorted tea jellies, right? Easy to make. You can use gelatin, or you can use a vegan or vegetarian alternative called agar with a bit of water and then some tea, some loose leaf tea, and then strain it out. Generally, they're sugar-free. You can add some sort of alternatives like stevia if you want that added bit of sweetness, but they're full of antioxidants, full of vitamin C, and full of amino acids. Really easy to make. You can batch make them. They taste great. So they go down really well, especially with teenagers. Now, the protein and bliss balls, I came across these in my university days, and they were absolutely essential to my health and my sort of general well-being and immune system. Really good source of protein, right? Lots of essential minerals and amino acids, low fat, low sugar, and there is hundreds of different recipes for these online. So it doesn't matter who you are. If you don't like something, there will always be an alternative recipe that you could make instead. So excellent, excellent choice of snack alternative there. And next slide for me, please, May. So just some conversation starters for engaging young people in sort of eating healthier. Number 1 is finding out what they do and don't like. You know, it's as simple as that. Make a list. What do they not like? I can guarantee you for every 1 food they say they don't like, there are 10, 20, 30 alternatives in your local supermarket that they could be having instead, which they will like. Link their food with their life. Now, lots of our young people are engaged in sport outside of school, engaged in other activities and extracurricular things. And I guarantee you that they will have role models and idols that have said something positive about healthy eating. So link this into them, make it more about, well, it's good to eat healthy because it will help you here as well with your own interests. So don't just make it a chore, make it something to look forward to. Giving them ownership, right? Young people love to be independent. So giving them some amount of control over the foods that they're eating really sort of makes them feel in charge. Perhaps taking them to do the shopping for the week and letting them pick some of their healthy snack options themselves, or letting them pick which fruits are coming home or which vegetables are going to be used that week. Just that little bit of extra responsibility really gets them to engage a bit more. And one of the key things is make the right foods available at home. More often than not, if there aren't sugary drinks or crisps or sweets at home, yeah, teenagers and kids will go out and they'll buy it from the shops with their own money. But generally, if it's not at home, they're not going to spend a lot of time eating it because it's not readily available. So those 4 points would be my key things for engaging young people in a healthier lifestyle. Now, if I could have my last page, please, May. So on here, and this will be shared with you at the end, there are just some key websites which I use on a day-to-day basis to find all of my recipes. They're all really easy to use, and they have some great information on there, as well as some video guides for cooking. So excellent for young people. Now, it was lovely to speak to you all. I'll be answering questions at the end with Clara and May, and I'm just going to hand over to May, who's going to go down the exercise for immunity route. And thank you very much.
Okay, hi everyone. Nice to meet you. I'm May. As you already know, I'm a teacher of PE and sport science, and I'm currently studying for my postgrad in food, nutrition, and health. So today I'm going to talk to you a little bit about what exercise does for our immunity, and I'm going to just expand a little bit on what Clara said about sleep. Okay, so firstly, why should I exercise and how does it help my immunity? So firstly, it decreases our stress levels. First of all, increased stress hormones are known to impair the functioning of our immune system. And therefore, if we are stressed, we are less likely to be able to fight off infections. Stress can be caused by a number of factors, from the obvious ones, such as work and deadlines, to stresses that are subconscious, meaning although we might not recognize them as stress, our bodies certainly do. An example of this might be as simple as rushing from one place to the next in a busy environment. These subconscious stresses can build up over a long period of time, resulting in high levels of stress hormones, which are known as adrenaline and cortisol. Exercise, however, reduces these stress hormones and instead stimulates the release of chemicals in the brain known as endorphins, that are the body's natural painkillers and mood elevators. Lowering our levels of stress hormones therefore allows our immune system to function more effectively, as well as helping our mental health. Clinical trials have proven that exercise can be used to treat anxiety and depression, as well as stress. Next, exercise kickstarts our immune system. So white blood cells are the components of our blood that help fight off infections. Moderate exercise has proven to increase the circulation and a number of white blood cells in our body, therefore helping us to fight off infections more effectively. Exercise reduces the chance of obesity. We all know this, but how does this impact our immunity? So studies have shown that being overweight or obese has actually similar effects on our immune system as being underweight or malnourished. A high amount of body fat has been linked with an impaired immune system, therefore meaning we're less able to fight infection. In addition, being overweight or obese causes inflammation that Clara talked about, which leads me to my next point. Exercise reduces inflammation. So inflammation is the body's defense system, which comes into play when our body wants to protect us. If you think of a sprained ankle, when we hurt our ankle, it swells up. This is the inflammation response. It's designed to help protect the ankle from further injury. However, we don't want this swelling there for a prolonged period of time. If we are obese or overweight, we are in a state of chronic inflammation. Chronic inflammation places too much stress on the body and therefore impairs our immune system and ability to fight off infections and disease. Next, exercising, especially outdoors, increases our vitamin D intake. So vitamin D is one of the essential vitamins that we cannot make or produce ourselves. As most of you will know, our major source of vitamin D comes from the sun. Exercising outdoors increases our exposure to vitamin D, and which we need to help us with absorbing calcium to help strengthen our bones. In addition, however, it's now becoming clear that vitamin D can help boost immunity, and in particular, reduce the chances of upper respiratory tract infections. Finally, some studies have shown or suggested that regular exercise may help to flush out bad bacteria through the increase of blood circulation, which helps organs such as the kidneys and liver improve their functioning. So, how much exercise should we actually be doing? Slightly different for children and adults. So for children and adolescents aged 5 to 17 years old, they're recommended to do at least 60 minutes of moderate to vigorous intensity physical activity daily. For adults aged 18 to 64, you should be doing at least 150 minutes, which is 2.5 hours, of moderate intensity physical activity throughout the week, or an equivalent combination of moderate and vigorous intensity activity. Everyone should be doing muscle strengthening activities that involve major muscle groups on 2 or more days a week. Now, how should I exercise? And what do the recommendations look like? It can be hard to break down all these recommendations from the WHO. Adolescents should aim to be active for 1 hour a day, every day. That's the easiest way to think about it, okay? And in addition, they should be doing weight-bearing exercises 3 times a week. So that includes things like weight training, push-ups, anything that's working their muscles to make them stronger as they grow. It also helps with their posture, especially when they're learning on a laptop, they're able to hold themselves up, okay? Reducing neck strain and further injury. For adults, it looks a little bit more complicated, unfortunately. Aim for at least 30 minutes, 5 days a week. To be safe, I would say 30 minutes every single day. Now, you might be asking, what sort of intensity is classed as moderate? What's vigorous? What's the difference between all of this? So for the intensity, to reap the benefits of exercise, you need to focus on activity that increases your heart rate. Walking at a steady pace is a good start and should be done daily. However, this should be in addition to the recommendations above, as it would probably not meet the requirements for moderate activity. I would say this is more low intensity movement. So thinking about getting your 10,000 steps in, that's great, and we should all be doing that. But in addition, you need to be getting your heart rate up to improve your cardiovascular health. So to really look after your health and be exercising at a moderate to vigorous intensity, you need to make sure you're increasing that heart rate. Aim to do something that raises your heart rate for at least 30 minutes every day. So it should be high enough that you can hear yourself breathing, and it should be too difficult to hold a conversation. So if you're doing something and you're having a chat with your friend or your partner, you're probably not working hard enough, okay? And this goes for adolescents as well as adults. So next, what type of exercise should I do? Research has shown actually doesn't really matter what exercise we do. You just want to be moving and getting your heart rate up. So the main thing is whatever you enjoy. Depending on your needs, you might walk at a slightly faster pace than I've mentioned to make it moderate intensity. You might run, cycle, swim now that the pools are open, or do some weight training sessions in your gym. If you do weight training at high enough intensity, you can also increase your heart rate. The key is just to move and increase your heart rate. I can't stress that enough. So next, I've got a few tips to increase your physical activity. First one is set realistic goals. Have a look at what you already do. What do you have access to and what's convenient? If you have to travel an hour to get somewhere to exercise, you're probably not going to do it. We don't have those 2 extra hours in the day to travel to somewhere and back again. So have a look around you and see what the options are. Second one, take the stairs. This is a great way to increase your movement. Going up the stairs is great for your cardiovascular health as well as your muscles. Living in Hong Kong, there are stairs everywhere, okay? Avoid taking the escalators. If you're on an escalator, try and walk up those stairs. You could get your friends or family involved. So exercise is obviously so much more enjoyable when you have somebody to do it with, and it's a lot more motivating. Having someone to do it with also makes you accountable and makes you more likely to stick to it if you motivate and encourage each other. You could make walking part of your commute. I love to do this. So you can walk a portion of your journey by getting off maybe the bus, the stop early, and walking the rest of the way. You could walk to the MTR after work. Have a look at where you could incorporate a little bit of walking into your daily routine, okay? Take regular breaks from sitting. We are all guilty of sitting. I know my watch always tells me every hour to stand up and move, which is great. You could set an alarm if you don't have a smartwatch. When you stand up, take a few steps around your house, do a stretch, and please encourage your children to do this in between their lessons and when they finish school as well, okay? It gives their eyes a break from the screen. It gives them a chance to switch off for a few minutes and refocus, and it releases tight muscles as well. Lastly, make it fun, okay? This links back to point number 3 quite nicely. Make sure you're doing something you enjoy, because it's then gonna be more long lasting, okay? A last one from me is make a plan and schedule your exercise into your daily routine in advance. Don't wait till the morning to decide what you're gonna do, because you're probably not gonna do it. Make it a non-negotiable. If someone asked you out for dinner and you had a doctor's appointment, you probably wouldn't go to the dinner. You'd say, I've got a doctor's appointment. It's really important. Think of your exercise routine as an immovable commitment, okay? So once that's locked in, that's not something that can change. Of course, we have to make adjustments, but try to make it part of your set schedule as much as you can. Now, moving just back on to sleep, following on from Clara. We know it's important, we know it's good for our immunity now, but it is often overlooked, and I cannot stress how important it is to get the right amount of sleep. So the chart shows us how much sleep we need, and importantly, how much sleep our children need. If your child is in year 7 to 8, they most likely need 9 to 11 hours of sleep. For children in year 9 and above, it's 8 to 10. For most children waking up about 7 o'clock in the morning, this means they might need to get to bed as early as 8 o'clock, okay, which sounds really early, but this is what they need to be doing. Research suggests that when we sleep, the proteins that Clara mentioned before help us fight infection and reduce inflammation and stress. The less we sleep, the less of these proteins we make, and the less we're able to fight off infection. So it's so important to develop a healthy sleep routine, not just for immunity, but all aspects of our health. It's the foundation of our health, and it's vital for our cognitive function. If your child is not sleeping enough, their energy levels, their concentration, their memory, and therefore their academic performance is unfortunately going downhill, okay? An extra hour of sleep is more beneficial than an extra hour of study. That is a proven fact. So a final word on the importance of staying healthy. Lots of tips on the PowerPoint there. It's important to know that there's not one quick fix. Only sleeping is not going to fix you. Only exercise is not going to fix you. Only eating well is not going to fix you. It's a combination of everything and a fine balance of all these components. So focus on a positive mindset and think about what you can do as opposed to what you can't do during this time, and just overall for our everyday lives. Make any changes you make realistic and sustainable, but don't try to change everything at once. Take small steps at a time. This could be going to bed 10 minutes earlier each night until you're going to bed at that ideal time to get the right amount of sleep. So in a nutshell, be better, not perfect. Thank you all for listening. I'm now going to hand back over to Claire, and we're going to be going through some of the questions that have been asked.
Thank you, May. Thank you, Dean, and thank you, Clara. If Dean and Clara can join us as well, that would be fantastic. So thank you very much. I hope you've picked up some tips and guidelines on staying fit, staying healthy, and building up your immune system. If you have any final questions that you want to type in, now is your opportunity, and the panel are very happy to answer a few questions in the amount of time that we have left, which is around 5 minutes. I have got a couple of questions that have come in already, so thank you to those parents that have already asked some questions. And one, May, was if our children do PE at school, I know you talked about the timings and exercise, but if they do PE at school, is this enough? Should they be doing more?
The answer to that question is PE is absolutely not enough, okay? I would encourage you to not count PE as your physical activity, because although we encourage our children to be as active as we can in our lessons, we are also teaching them to develop these healthy lifestyles, and we do have alternate focuses in our lessons. So it does mean they are sitting down, they are listening to us, and you know, sometimes they're working on skills which aren't specifically getting their heart rate up. So I definitely would not count it. And in addition, they have 3 lessons, if that, per 7 days. So sometimes we'll only see them twice in a week. And by the time they've got changed, you know, we've had a discussion, they're not active for long enough. So please encourage them. And also, because we're on this 7-day rotation, it's not like they can say, oh, every Tuesday I'm doing this. So it is different. And if they want a regular schedule, which they should be having, PE just kind of disrupts that. And just think of it as an added bonus.
Okay, thanks, May. And, you know, I think an important aspect here is that we just try our best, don't we? And I don't think we should worry too much if we can't get to that every single day, but it's what we aim for, and we just need to encourage as well, and not worry if it doesn't happen every single day.
Yeah, one day, there's tomorrow.
Yeah, exactly. And another question that's just come in is about the right foods, Dean. You've touched upon it with regards to broths and really nutritious foods, but an ideal breakfast, Dean, for a young person, one that's going to keep them full and energetic for the day ahead? Any further suggestions?
So breakfast is, you know, it is arguably the most important meal of the day. You've just spent, you know, hopefully 8 hours asleep, and you hopefully haven't eaten straight before bed. So it's been 10 to 12 hours since you've last reasonably had a decent meal, and now you're going to get up and you're going to spend the day doing, you know, hopefully a lot of learning and physical activity. So carbohydrates are key, especially in our young people, growing rapidly, developing, playing lots of sport, generally being more active than us adults. A large amount of carbohydrates. So your oats, your bran flakes, make them whole grain or wholemeal. So if you're having toast, brown bread, you know, granary bread. If you're having cereals, try and avoid, you know, your Cocoa Pops, your Frosties, even things like Cheerios, which are sort of marketed as a health breakfast. Plain oats, plain bran flakes. Spruce them up then with nuts, you know, seeds, okay? Maybe a teaspoon of honey, some natural alternatives like that, but avoid your big brand sugary treats. Avoid, you know, your big fatty cooked breakfasts as well. Oats, something like that. Fruit, if you're going to have any sort of sugar, you do want a bit in there to sort of wake them up in the morning, but fruits and honey, right? There's, you know, a plethora of fruits you can have. Add them in. There's a lot you can do with it. Overnight oats in particular work well. But they are going to need it. Now, on top of that, I would encourage all of our young people and students to have a snack to see them through to lunch, regardless of the size of their breakfast they eat. You know, a lot of these teenage boys especially are going to get to school after a big breakfast. They're going to be starving by break time. So trying to get through to a 12:30 lunch just isn't ideal. Even a banana or an apple, something like that with a quick sort of natural sugar hit, that's key as well as a good breakfast.
Yeah, that's great. And Dean, when you say overnight oats, are they oats that you would soak?
Yes, so overnight oats, yeah, you can sort of make up your oats overnight, so you don't have to mix them or you don't have to cook them. Just all your oats, your fruit, your nuts, your seeds, anything like that, with your soya milk or your milk or any other milk alternative, stick it in the fridge, leave it overnight for 8 hours, and it comes out lovely in the morning. Okay, almost so like a cheesecake.
No cooking, just a soak.
No cooking, just a soak.
Okay, all right. I think we've covered most of the questions now. There was a question about how do we empower our children and encourage them to self-care, and I hope that you would agree that May and Dean have talked about that in terms of giving them choices and opportunities. But Dean and May, if there's any other ideas, now's your time to share, but I think you covered it quite comprehensively in the presentation.
Yeah, I would say on that, just give them a choice. You know, like Dean said, there are so many alternatives. If they say, I don't like that, ask them, what foods do you like? And search some recipes, you know, things like that BBC Good Food website. You can literally type in all the ingredients you've got or that they like, and it will come up with recipes with those in there. So that's a really good option.
Okay. All right. Thank you so much for joining us this evening and taking some time out of your busy days. We will share the PowerPoint with you, with the links to the recipes, the links from Clara, and the information from May. And I would say that it's an up and down journey, isn't it? Our self-care routine. Some days it feels great, some days not so great. And I think, as we say, and as May would say, you know, there's always tomorrow and we can always reboot and start again. But I think we've got the foundations for success and the tools at our fingertips. We can draw upon those and really work with our families to aim for the optimal health that we can. So take care, everyone. Thanks for joining us and have a good evening.
Thanks. See ya.
Thank you all.
Thank you very much.